Hello again, it's Dr. Harim Jafar Hamar Rashid. I am periodontist. I am just about to present a series of lectures about the periodontology. In the previous two lectures, we discussed briefly about the clinical features of the gingiva in the adult and child. And nowadays, we are going to talk about the history and examination. And we should discuss some of the main points that are crucial to know in detail about the history and examination. Please, before we start, subscribe to HL Talent to get more videos about periodontology. So, from the periodontal viewpoint, the aim of history taking and the clinical examination are to establish the extent of periodontal destruction and to evaluate the effect of a disease on the remaining dentition. It's also important to evaluate the individual patient's susceptibility to periodontal disease and, as far as possible, identifying the sites that appear to be associated with the active or ongoing destruction and the need to be considered a priority for treatment. Regarding the presenting complaint, one of the principal features of the periodontal disease is that their onset and progression occur often in the absence of the pain. So most of our diseases are painless. This means that the detection rests firmly on the hand of the clinician, and the importance of regular examination must be impressed upon the patient, with the emphasis placed on prevention rather than cure. So the clinician should motivate his patient regarding the ways of prevention, and the patient must take it in serious regarding the prevention of the periodontal disease. The well-informed patient who is a regular dental attender should be able to detect some of the signs and symptoms associated with the disease. Unfortunately, many patients are irregular dental visitors, and they only present their complaint at the time when the problem is happening, which is the disease. When gingivitis and periodontal inflammation do cause symptoms, bad taste or breath, localized pain, and teeth that have been changed position or become loose, details of when such problems start, the frequency of pain or discomfort, and any associated symptoms should be recorded. The expectation of the patient with regard to the outcome of treatment should also be discussed at this stage. First of the complaints, I choose the most important 5 complaints that most of the patients seeks during periodontal treatments. One of them is gingival bleeding. Bleeding gum is perhaps the most common complaint of the patient with periodontal disease. The bleeding is usually noticed during or following to the brushing or eating. When bleeding occurs spontaneously, a patient may complain of testing blood on awakening in the morning. The severity of the hemorrhage doesn't necessarily relate to the severity of the disease, as a marginal gingivitis can be associated with quite profuse bleeding. So the amount of bleeding is not indicative of the severity of the disease. Gingival bleeding is exacerbated by the use of certain drugs like anticoagulants and antithrombotics and fibrinolytic agents. Symptoms of relatively recent and sudden onset should be investigated thoroughly when taking the medical history. The second main complaints of the patients that are coming to our clinic is drifting of the teeth. Drifting of anterior teeth and the presence of space between the teeth are often the first sign of an underlying periodontal disease. When teeth begin to drift, it's because that their periodontal support has been compromised to such an extent that the teeth are no longer in the equilibrium that with the force of the occlusal, with the force of occlusion. In some cases, this position of equilibrium is so finely balanced that the destruction of only crestal bone and the coronal periodontal fibers will participate change in the tooth position. Furthermore, the pressure exerted on the teeth by gingiva that are swollen through edematous or fibrous change can also induce tooth movement. So the pressure on the teeth by gingiva that are swollen, so the swollen gingiva is also another cause of drifting, or fibrous change when become more fibrotic, may be another enhancement for the drifting of the teeth. Drifting of anterior teeth may also be a consequence of an occlusal interference in the posterior segment, which leads to a forward slide of the mandible during its arc of movement from the reduced contact position to the intercuspal position. The third main chief complaint is the loose tooth. Actually, when periodontal disease remain untreated, the attachment loss is progressive and the teeth become increasingly mobile. The degree of mobility that some patients accept before attending for treatment is remarkable. And many patients still believe that increasing tooth mobility is ultimately a natural consequence of aging process, without thinking that this problem is related to either an excessive force or to the weakened periodontium. As we see here, we have two examples. For example, in this case, we have a totally healthy periodontium, but we have an excessive force beyond the limit of the tooth and the periodontium. So this may cause the periodontal problem or the periodontal complaint, which is indicated in loosening of the tooth, to loosen the tooth inside the socket. So the cause of this excessive force should be removed. Either it's a high spot, it's an imbalance between the upper and lower jaw, it's loss of the correct occlusion, needing orthodontic appliances, etc. In the another case, another example, we have a normal force but destructed periodontium. So in case of destructed periodontium, even normal forces will cause a loosened tooth. So the patient should seek the treatment or management of the periodontal condition. The fourth main complaint that makes the patient come to the clinic is bad taste or halitosis. There will be an altered sensation of taste, which can be accompanied by the halitosis is associated with, for example, necrotizing ulcerative gingivitis is one of them. Periodontal abscesses, or if the patient have a poor oral hygiene. Or maybe excessive bacterial growth on the tongue. So the non-cleaned tongue. So these causes, maybe the oral causes for the halitosis or bad odor, and we have an external cause other than the oral causes, which we talk about it in a separate entity. Last main cheif complaint is pain. So in case, as we talked about, in case of periodontal diseases, most of the conditions are painless, but sometimes pain is one of the main chief complaints that make the patient come to the clinic. Acute and often quite severe pain is a feature of necrotizing ulcerative gingivitis and herpetic gingivostomatitis, which we talk about maybe later. Pain, in particular on eating, is also a symptom of an acute periodontal abscess and or a perioendo lesion. Pain on eating. Gingival recession with exposure of root surface can also participate in pain initiation, but it should be the dentin should be exposed. We should have a lost cementum, which may be exposed due to brushing, to the brushing technique, wrong brushing technique, false technique. This pain is characterized by a sharp and transient pain with a sudden onset and mostly associated with a stimuli. Pain is not typically a feature of chronic periodontitis. So we should take in mind that it's not a main feature of chronic periodontitis, but maybe in acute cases we may have pain. And in periodontitis, in case of presence of pocket and abscesses, we may find it. And thank you for your listening.